fine dining restaurant in New Orleans is being linked to hepatitis A cases, which are on the rise across the state.
As Mike McDaniel explains, while most people survive this infection, there is still some concern of the spread.
Already dealing with health concerns from the COVID pandemic, Galatoire's restaurant in New Orleans is now reportedly dealing with cases of hepatitis A. The restaurant released a statement to WWL saying the State Department of Health alerted it to a potential incident from early to mid-August. The statement does not say how many cases are linked to the restaurant, the possible source, or whether employees or customers were infected.
It's hard to say where this infection may be coming from. It could be, as I said, an infected food handler, or it could be that there's some food they got that was infected prior to delivery.
That statement goes on to say, consistent with our own high standards, we embraced the assistance of the Department of Health and together outlined steps Galatoire's could take to be as responsive as possible for our team and our guests.
Obviously, eating at a restaurant, some things are beyond your control, but I don't think it's grounds for undue paranoia about eating out.
Dr. David Mushat with the Tulane School of Medicine says hepatitis A is a very contagious, vaccine-preventable liver infection spread through ingestion. Symptoms include loss of appetite, nausea, vomiting, and diarrhea, but aren't long-lasting.
Hepatitis A is an acute infection that does not require medication to treat it per se, because it will go away if you survive the infection, and most people do.
Dr. Mushat says hepatitis A cases have been on the rise since 2016.
Some of that is associated with the opioid epidemic and the increase in injection drug use.
According to the State Department of Health, as of September 17th, there were 1,249 cases with 4 deaths. Orleans, Livingston, and East Baton Rouge parishes have the highest case counts in southeast Louisiana. At Galatoire's, the restaurant is having employees vaccinated, which Dr. Mushat says is something everyone should think about.
You can see your primary care doc, and you can have them check your records to see if you were vaccinated. If not, you can get a blood test to see if you're immune.
Mike McDaniel, Eyewitness News.
Good hygiene, like hand washing, especially after using the bathroom, is one way medical leaders say will limit the spread.